Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa Snow and your host, Greg Phelps.
Hello and welcome to the Dementia Care Partners podcast, brought to you by Tover, the creators of the Tover Table. The Tover Table, which means magic table in Dutch, is an award-winning dementia care tool. It projects interactive serious games that are scientifically proven to improve the quality of life and support caregivers in providing person-centered care. Tover, the power of purposeful play.
I'm your host, Greg Phelps, along with Teepa Snow. And Teepa, our question today was short and simple, as it simply said, CNA skills, ? Can we talk about skills in general? What sort of skills might somebody need if you're working with a person living with dementia? And why do you often suggest a team approach? So, we can back up and address those individually.
Okay, so CNA skills, certified nursing assistant or personal care assistant. In both countries, the US and Canada, we have determined that, someone determined with me, that there should be people who have a basic understanding of how bodies work, what kind of conditions people might have, and how to provide care, physical assistance care, physical care to those bodies. And so CNAs and personal care assistants are primarily trained in what had historically been nursing tasks. So when nurses got really busy doing lots of things, including medication management of wellness stuff and all that, they assigned these people to basically get to a place where they would know how to hygienically clean someone's bottom, clean somebody's armpits, help somebody or brush someone's teeth, take care of someone's dentures, be able to shave someone, be able to clean someone's fingernails and possibly wash their bodies and mobilize them and help feed them. I mean, and I have to catch myself because truly they are taught to do things for people in place of the nurse. And then they're taught, but first you find out, is the person willing for you to do it? So you ask them a question, can I brush your teeth? Or they might say, do you want to brush your teeth? And the person says, yes, I want to brush my teeth, but I can't, I have a broken right arm. And they would say, okay, well, do you want me to brush your teeth for you? And if the person said, well, no, I'd rather you put toothpaste on my toothbrush and I'll use my left hand. The aide goes, oh, okay, well, that's fine, but you missed some. Can I go ahead and get that? But it's primarily a role of care support.
Well, I was going to ask, what I heard you saying was it sounds like the job is very task-oriented.
It is trained in that manner. So we teach people to do tasks and we teach them to do them in a check-off way. So we make sure that they don't miss anything because heaven knows we wouldn't want them to miss anything here. So we teach them the sequence of how to do tasks. And then we teach them on mannequins frequently because, mannequins aren't, needing to go off to do something while somebody tries 3 times. So mannequins will put up with a lot. And then we say, okay, now you're going to take care of people. So, Greg, in your life, have you ever felt like a mannequin?
Only a couple of times in the hospital.
Oh, in the hospital. So what's different about living for a couple of days, maybe post-surgically or something like that in a hospital versus living the rest of your life? What do you think might be a bit different about it?
Well, you're feeling a little more vulnerable, a little more exposed, a little less able. You're probably at one of your lower points.
Yeah. So in fact, when people are hospitalized, we're willing to give over more, or we're not really with it enough to hang on to stuff. And so having somebody manage those things makes sense. But the challenge for us is when the difference is, frankly, that I'm coming, I don't realize I have something wrong, or maybe I do, but this whole strategy of teaching people to do tasks and then to give them people to do them on, and you get permission, but the getting permission was done how, Greg? How did I get permission?
Just simply by doing there wasn't an awful lot of asking permission. It was just, I'm here to do this, I'm here to do that.
Well, I'm here to give you a shower. Are you ready?
Oh,
Did you
yeah.
ask? But so what's the answer? It could be a yes or a no. And if there's a no, then it's called a refusal. And people have rights to refuse. And so what happens is I don't do it. So when we add dementia to this mix, we suddenly have a big problem. So I think the issue for me is that we're training the wrong way. We need to train our staff, our people who are going to give the care, at least where most of us are concerned, with how to do a permission, whether it uses language or not, and how to support someone's doing of something in a way that supports their abilities, not get the job done. And that's, I think, one of the biggest challenges we face is we teach people one way and we actually would like them to do it the other way, whether it's us or somebody we care about, quite frankly.
So have you liked every person you've ever met in your whole life? I know I haven't. There's some people you just don't resonate with. And if that person comes in and says, Greg, let's take your clothes off and have a shower.
Yeah, I don't think so. Yeah. Hey, Greg, I have a big favor. I know you may not be my biggest fan, and I know that I'm not your favorite person. I also know you would like to get down to breakfast. I'm wondering whether we can strike a bargain here.
So on that level, I think you and I would connect because you've reached out to me.
Yeah.
But if I had dementia and I just was hearing wah, 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 and I don't like you.
We may need to switch people.
Oh, that's that team approach thing you were talking about.
It's called that team approach because frankly, I may not be a good match for you. Or quite honestly, you may not be a good match for me because of something in my past, in your past, in our relationship, in the way we hear each other, my voice, your movement. I don't know what it'll be, but to view you're like, well, I've got to get you cleaned up. It's like, well, no, it would be great if you did get cleaned up and down the hall, but I think the more important thing was you ate. So I'm going to back up a little bit and see if, hey, Greg, could I get you some? I know I'm not your favorite, but could I get you something to eat? Because after you eat me, you may like me a bit more. I don't know. I mean, we give it a try, change our focus, change the place we're interacting. But we've got to build out, I think, is what my message is. Asking one person to take care of 8 people.
It's sort of human nature. If somebody does a favor for you, that you have a more favorable opinion of that person.
It's called a relationship. Yeah.
Oh, relationships. That's important.
Apparently for me.
But if I have dementia, I might not remember you again later.
You might, but I might be able to do it again and again because once we've established you have some sort of remembry. It's not actually a memory. It's an emotional feeling. And if I can trigger it again and again in a more positive, guess what? That dislike might become tolerance.
So are these skills that the average person can learn, or is this rocket science that I have to go and take ballet for 5 years? And
I absolutely do not believe it is rocket science, but I do believe it is not for everybody. I mean, I'm going to be honest. I think there are people in the world that this is simply not a good match for. Relationships have always been hard for them. And so they're much better at tasks, in which case we should have them participating in tasks that don't involve a lot of human beings. And they'll probably be much happier, and so will we. And we have to figure out how we're going to interface with them. So if somebody's great at the laundry, why am I having them deliver it in people's rooms where you have to really have interactions? If it's not a good match, it's like, tell you what, thank you for bringing this up here. I'll distribute it. Oh, and I have 2 more bags of stuff that do need to be washed. And you are absolutely the best. It's just a thought.
But where can a person get these skills? Back in the good old days, we were out teaching, but are we online with these skills? Can I sign up for classes?
Absolutely online. They're called champion courses, and there's 4 of them. And it starts off with just the basics and builds up. We also have mentor sessions if you want to do a one-on-one with a situation you're interested in building your skill in. Or we have care partner support series. If you're a family member and just trying to wrap your head around what's my job here and how do I build a team and what's that look like? Because we know each person is unique and And there's a whole bunch of uniques out there, but we also know there's a whole lot of dementia floating around and a lot of people who are trying to figure out, how do I do this? So we do our best to support where we can.
So where can I get the information? Can I find something on the website?
You absolutely can. TeepaSnow.com. And if you indicate you're an individual and you're interested in something, it'll take you to some different places where you can check out. Or we have a chat line, and we have an 800 number, and we also have an info@teepasnow.com email.
Teepa, thank you very much.
Thank you, Greg.
You've been listening to the Dementia Care Partners podcast, brought to you by Tover, makers of the Tover Towel. For more information, www.tover.care. And for more information on positive approach to care, check the website at teepasnow.com.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching, and if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out. And you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.